Shingles. It's an age-old skin disease that affects 500,000 Americans each year. And although it can affect all age groups, it is especially common among the elderly.
Now, this is an infection that occurs mostly in older Americans. And as our population ages, the likelihood that we will get shingles will also increase. By the time people are 80 years old, almost half of them will have a bout of shingles.
I must say that I wouldn't wish the instance of shingles on my worst enemy, because for the better part of 2 weeks, I was absolutely miserable.
Irwin Cohen was in his 70s when he got shingles.
But for the better part of a month and a half thereafter, I still had no energy. It was so unlike my normal activity.
The shingles virus lies dormant in nerve cells near the spine. When it reactivates, it follows a single nerve path to the skin.
It's caused by the same virus that causes chickenpox. About 4 million of us get chickenpox every year, and that virus stays in the body for the rest of our lives. And later on, it reactivates.
Shingles usually develops in 3 stages: severe pain or tingling, possibly itchy rash, and blisters that look like chickenpox. But unlike chickenpox, shingles only affects one side of the body.
The location of the rash is a clue if the rash is shingle or not. The shingles rash occurs in one side of the body, usually like a belt or a band, or can occur on one side of the face. It usually starts as a patch of dots, red dots, that then will become blisters.
Irwin Cohen's case of shingles followed this pattern.
Not recognizing what my problem was, I had what I thought was a mild virus, and then temperature developed. I think I got up to about 102, and then I went to my doctor. When he examined me, there was a small rash on the back of my neck and the top of my left shoulder, and he immediately diagnosed it as shingles.
Irwin Cohen's bout with shingles lasted about 4 months, and he recovered completely. But sometimes there are complications.
About 15% of people who get shingles get it on the forehead. And when it involves the forehead, it can spread to the eye and cause injury to the cornea and blindness. There are all sorts of other neurologic complications with paralysis as well.
While most people who get shingles do not have complications, almost everyone with shingles experiences pain.
Most individuals over age 60 get pain. Fortunately, it goes away in a month in most of them. But there's a subset of people who are bedeviled by pain for many months or even years.
To treat shingles, doctors use antiviral and pain medications. The antivirals are not a cure, but they weaken the virus and can reduce the pain and speed the healing.
You definitely should go early because the antiviral medications will work best if they're started early. The best is if they started within 72 hours from the appearance of the rash.
The upside to shingles is that if you are basically healthy, it usually resolves without complications. You are not likely to ever get it again. And life did get back to normal for Irwin Cohen.
I was working at the time for First National Bank of Maryland. I wrote them a letter resigning on the theory that I just didn't have what it takes to operate on a day-to-day basis. They insisted that I continue later on when I felt like it, and about 2.5 months later I went back to work.